Manvir, I hand over to you for your comments before we start the questions.
Thank you, Dr. Krishna. Also, I want to thank Dr. Ratna and Mugda and the team here at PAIR for putting this together. Fantastic. Please give them a big round of applause for fantastic work that they've done to do this the second time around. Now, as we're talking about climate change and where this happens, and we've been having a pretty robust conversation a bit earlier, but when we're talking about CVDs, cardiovascular diseases, and the causes, so it's also good to take a step back and start looking at things in a different sphere. Like what Dr. Krishna was saying is our responsibility for this. We cannot just leave it to the governments. And where I'm going with this is just to give you an example of 5 blue zone countries. Now, blue zone countries, I don't know whether you have heard of it, but you can Google that, right? They've got cities like Okinawa, Nicoya Peninsula, Sardinia, Ikaria in Greece, and Linda, which is in California. These are 5 places where people live the longest. They spend the least amount on healthcare, right? And how does this happen? And that's what we're looking at right now, just not taking it as a disease, but looking at how this happens now. The 6th unofficial blue zone city is Singapore, which was an engineered city, right? And so you can go and read about that. But where we're going with this conversation is obviously with climate change coming into it. What are our responsibilities? How do we add into this? How do we have this conversation? Because at the end of the day, the patient is the one that is sick. And the patient, more patients being sick can break a healthcare system. And I often like to say this, that the ministries of health in every single country, whether it's India, Malaysia, the US, or wherever, are getting it absolutely wrong. They are not the Ministry of Health, they're actually the Ministry of Sick. Because only when you're sick do they take care of you. So there is no preventative measures, right? Because if you look at the Ministry of Transport or the Ministry of Defense, they are supposed to provide you transport to get to one place to another. So they build all that infrastructure in. But here we are only building it at the last mile, which is the hospital, right? So people fall sick and then they come. And eventually, when you look at, I was just now talking to the young people from the university at the back there, and very interestingly, I heard just now about the shisha culture here in India. It blew my mind, right? And so we have to start thinking about being proactive and asking our governments to institute a sort of a sin tax. When we're talking about tobacco, we're talking about alcohol, where does that money go to? Does it go to healthcare? Does it go into the pocket of the government? And they build highways or they buy new guns. What are they doing with it? But healthcare needs that funding, right? So we have to start thinking about that. And while we're talking about the younger people, the McDonald's and the KFCs and all that, are they really good for us? Are they contributing to CVDs? Are they contributing to NCDs? So these are the conversations that we need to have, right? And now I'm going to hand over back to Dr. Krishna, and let's pose with our 4 experts here these questions and how they have, in a little way, made a dent or have understood the problems and the issues and have been tackling that. Dr. Krishna.